Good morning, everybody. Just about turning 9:30 here on Live Impact News. And this morning, after facing relapse of one of the most aggressive and fast-moving forms of cancer, one mother sharing her journey to help raise awareness about small cell lung cancer, or SCLC. Joining us on Live Impact News is Dr. Tejas Patil, a thoracic oncologist at the University of Colorado Cancer Center, breaking down some of the latest developments in treating this disease. Alongside Kate, sharing her story firsthand. Thanks to you both for joining us this morning.
Thanks for having us.
Thank you.
I'm going to start with you, Dr. Patil. If you can explain what small cell lung cancer is and why it's considered so aggressive.
Sure thing. Small cell lung cancer represents about 25% of all cases of lung cancer. And part of the reason it's so difficult and challenging to treat is that most patients who develop small cell lung cancer have the cancer spread outside of the chest where it originally starts. So it can go to places like the brain or the bone. And historically, the treatments for small cell lung cancer involved chemotherapy. And chemotherapy, while it can initially produce results in terms of improving patient symptoms, shrinking the cancer on a CT scan, the biggest challenge we've faced as a field is that small cell lung cancer tends to come back. And when it comes back, it tends to be very difficult to treat.
Wow. Okay. So, Kate, let's talk about your story, the diagnosis, and what your journey has looked like, and including this relapse.
Yes, so my journey with cancer began in December of 2023. I woke up and was crackly in my lungs, and within a week I coughed up blood for the first time, which is a major red flag and not okay. I was really fortunate that I was able to get into a clinic the next morning and get a chest x-ray. They sent me immediately across town to get a chest CT. And this is, kind of scary stuff to be faced with all of this. And within a week, I was diagnosed with extensive stage small cell lung cancer. And so that's why we're here with y'all this morning on behalf of Amgen to talk about this disease and to show you a face of somebody who's, doing really well with some of these new treatments. And Jane, I hope you don't mind me pausing right there, but I began my career in Charlotte as a teacher, and so I just got to give West Mech a shout out. So to the fine folks at West Mech, I'm here.
Oh, we love it, Kate. Thank you. And they will appreciate their shout out as well. And nice to see you healthy as well. So then tell us what kept you going. And I want to actually start back in the early days of your diagnosis. It sounds like it came up all of a sudden as well.
It really did. And so as Dr. Patil said, by the time I knew something was wrong, it had already kind of spread into my lymphatic system. And so, I very quickly was in chemotherapy and radiation treatments. And as Dr. Patil said, it worked for a while and then it didn't. So I'm very grateful that we get to be here sharing with your audience and my old community that there are options and there are new treatments available that folks can talk to their doctors about. That's a really optimistic thing and a great place for us to be.
All right, Dr. Patil, let's go ahead and talk about this encouraging news. What are some of these new treatments?
Most of the new treatments that have made a dent in small cell lung cancer fall under the category of a class of treatments called immunotherapy. Immunotherapy is a type of treatment that allows a patient's own immune system to participate in the eradication of small cell lung cancer. And there are different forms of immunotherapy. I think it's important that every patient talk with their doctor about which type of immunotherapy treatment is right for them. But as Kate's story clearly shows, these treatments are effective and they do keep patients living longer and living better.
And Kate, what advice would you give to someone who is facing a diagnosis today?
A diagnosis can be really scary. And I think the one thing that's really vital is to lean on your community, whether that's family, friends, neighbors, your healthcare providers. I was one of those people before diagnosis that was making the meals and dropping it off and sending the encouraging text message. And so sometimes it takes a really specific intention to kind of flip into receiver mode. I think being open to receiving that love and support is really vital alongside working with your doctor to remaining positive and hopeful in difficult times.
Oh, wow. Amazing story and testimony to your health and recovery. Dr. Patil, any other takeaways we should have today?
The key takeaways I want your audience to go home with is that small cell lung cancer is an aggressive form of lung cancer, but with current new treatment options, mostly in the form of immunotherapy, we're really, I think, turning a corner in the way we treat this very lethal disease. It's super important for you to talk to your healthcare team and think about which strategy makes the most sense for you.
All right, sounds good. Dr. Patil, Kate, we thank you both for joining us here on Live Impact News. Appreciate the conversation and information.
Thank you.
Thank you.